Okay, I was gonna go on a walk and then I decided to make this one. Hi everybody. My name is Jim McFarland. I'm a licensed clinical social worker and clinical counselor. I'm an anxiety specialist in the state of Georgia and in the state of Florida. And what we're gonna ask and what this video is gonna be about is how do you know you're with the right counselor or therapist for anxiety, and how do you pick a good anxiety counselor or therapist? Okay, so here's some things you want to keep in mind. One, the biggest thing, and this is one of my biggest pet peeves, is that most counselors are going to advertise themselves as taking care of anxiety. And God, I don't want to be crass, but it just is what it is. That's bullshit. That is just patently not true. Now, I would say that most therapists that are worth their salt are able to deal with mild anxiety, and they're able to give you things, like breathing exercises or box breathing or deep belly breathing exercises, maybe some safety or grounding types of things, some visualizations and so forth to help you feel more safe, to feel more at ease. Maybe some mindfulness exercises, relaxation, progressive relaxation exercises, and so forth. And those are part and parcel for any good therapist that's worth their salt. They should be either able to do this for you and coach you through that, or they're able to give you resources like apps and so forth that can help, and different YouTube videos that can help you through that. Now, that's a far cry from actually being able to work with anxiety and help to actually fully diminish anxiety in a person, and then even eventually in some people cure it or take it away. Now, what does that? What makes that happen? So here's what you're looking for. First of all, you want somebody licensed. We're not looking, I'm sorry to say, I'm just going to cut this really clear. And I don't mean to disparage anybody. That's not my intention. I'm just telling you what the truth is. We're not going to visit pastoral counselors to try to take away an anxiety disorder. We're not going to visit anybody that's unlicensed trying to take away an anxiety disorder. And when we're working with an anxiety disorder, there is a very clear treatment protocol or set of treatment protocols for each individual anxiety disorder. And so the person that you want is somebody that's licensed in your state. So this can take a lot of different forms depending on the state. So this might be a licensed mental health counselor, an LMHC. It could be a licensed clinical social worker who's also licensed to do therapy. That's an LCSW. It could be an LPC, a licensed professional counselor. These are all what we call master's level clinicians or master's level therapists. Now, they've been trained all the way up through their bachelor's degree, all the way up to the master's level. And then from there, they've done several practicums and several internships and lots of supervised hours under the direction of another therapist. And so this is really what you're looking for. The other people that can take care of this and work with anxiety, this is the first criteria. It's not the only criteria, but it's the first one that you want. You want to check this box when you look for them, would be a PhD or doctoral level counselor. This would be like a PsyD, PSY, capital P, small sy, capital D, PsyD, or a PhD, capital P, small h, capital D, a PhD in psychology. These are the folks that are going to be now to maybe a lesser degree. I don't know if I'm sure they're out there, but there's probably psychiatrists that are good at delivering good anxiety therapy as well. They're rare, mostly psychiatrists. This would be an MD, a doctor, a medical doctor that's also gone beyond with a specialization in psychiatric a pharmacological intervention or medicines that work for the brain. Now, there are a few of those that still do therapy. They're kind of rare. I actually met one years and years ago when I was looking for solutions to my own anxiety, and I ran into this person, and she was great. She was a psychiatrist, and then I would sit there for an hour, and she would do therapy right in her house. It's pretty amazing. Now, looking back, I will say that I don't think she was equipped, just saying what it is. She was not equipped to deliver actual anxiety disorder treatment. She did good talk therapy. And so now let's get to that. So this is what you're mostly going to run into out there. So you want to be really, really careful with checking the credentials and checking the training of the individual that you're working, that you're going to work with, that's going to help you with your anxiety condition. Because as I said earlier, there's very specific protocols, there's very specific things that you do to help anxiety disorders. And just to be very clear, it may play a small part. Things like grounding and breathing exercises and meditation and yoga and so forth may kind of play a part in good anxiety therapy, but it's not the core. It's not the meat and potatoes of it. The meat and potatoes are just very clearly, point blank, is some form of exposure therapy, period. There is no other. There are no other therapies that really help with anxiety. Maybe the only possible exception, but these methods are arguably some type of exposure therapy as well, would be treatments for PTSD. This would be like prolonged exposure. This would be cognitive processing therapy, CPT. These would be EMDR, brain spotting, accelerated resolution therapy, ART, and some of these. So there's still a big exposure component in these, even in EMDR. And a lot of clinicians, would argue with me about this, but I'm just going to say it. What it is what it is. What we may be seeing with EMDR, this is a type of therapy that uses eye movements. It is not really helpful for hardcore anxiety disorders other than post-traumatic stress disorder. But the rest of them, OCD, obsessive compulsive disorder, illness, anxiety disorder, panic disorder, agoraphobia, generalized anxiety disorder, all of these other types of anxiety disorders do not respond very well to EMDR. I know, I was certified in EMDR. I've tried it and it works. When it works great. And where it works is with folks that have had trauma. That have had traumatic and that have traumatic anxiety. These will be intrusive thoughts. This would be things like intrusive thoughts, nightmares, exaggerated startle response, a lot of avoidance of certain triggers, not wanting to be around or look at or hear or see certain triggers or reminders about the trauma. So those are, in general, those are the symptoms, and those last for a period of time before they're actually called or diagnosed as post-traumatic stress disorder. So, so there are certain therapies, but even those therapies for PTSD also have, especially if you look at prolonged exposure, it's got one of the biggest amount of research underneath it that really help people with post-traumatic stress disorder, has a huge, it's literally prolonged exposure. Exposure to. Now, again, I'm just going to give a caveat here. When you hear exposure, when most people hear exposure, they think, oh my gosh, they're going to really just push me into stuff that's really, really scary and it's going to be awful and horrid. And no, it's not like that at all. It actually is done very progressively. Progressive exposure is a form of exposure, and it's usually a standard thing that a good anxiety treatment specialist and a good anxiety specialist will do. They will let you throttle, you as the client, they will let you throttle how that goes and how fast it goes, and even when that starts and when to take a break and all of that. That is all controlled by you, and that's what a good anxiety therapist is going to do. A good anxiety specialist. So what kinds of trainings are we looking for then? So we definitely want somebody licensed. We want to avoid things like pastoral counseling unless they are licensed as a licensed clinical social worker or an LPC, a licensed professional counselor, LMHC or LMFT, some type of master's level clinician, or possibly they have a PsyD and the PhD needs to be in psychology, not a PhD in history, not a PhD in, because there are some less than scrupulous individuals that will advertise themselves as counselors, and there may be more and they say they're a professional counselor, but their degree is not in psychology at all, and they didn't do any of the practicums or any of the internships and supervision that's required for that. So you want to be really, really careful with who you're entrusting your mental health and mental care. A coach. So are coaches certified to take care of anxiety? And the answer, just point blank, is no. No. Now, I would say there are a couple of coaches that I think have the right idea, but again, they're not licensed. They're not really governed by the licensure process. So, yeah, you want to stay with some type of professionally licensed individual that has an extensive amount of training beyond the normal master's level, master's degree and all of the stuff that requires to get licensed. Then you want them to have even more training beyond that. Okay, so what types of training are we looking for? So we're looking for a master's or a PhD level clinician, counselor. What we're really looking for is somebody who has some very specific training. So, what types of training and what types of things do we really need to take care of the anxiety disorders? Well, I mean, one of the core ones, it's going to be cognitive behavioral therapy, but I'm going to warn you right now, there's a lot of people saying they're doing CBT or cognitive behavioral therapy, and they are not. They are not. They took a quick training. And they're not certified in it. They use some methods maybe from it. And maybe they use a little bit of. By the way, some of the technique one. Maybe I'll circle back to that about techniques that you don't want. But cognitive behavioral therapy, CBT, you want that. And specifically a specific type of cognitive behavioral therapy. So what would that be? Well, that would be like any kind of exposure therapy. So for OCD, for obsessive compulsive disorder, the type of exposure therapy that you want would be exposure and response prevention. Exposure and response prevention. This has been studied. It's the gold standard for all OCD treatment, and it works. It helps people feel better so that they're not all tangled up in their thoughts and they're not all bogged down in all of their obsessions and taking hours and hours each day doing their compulsions and so forth. So exposure and response prevention is what works for OCD. What about for GAD? Generalized anxiety disorder. These are chronic worriers and people who get really caught up in a lot of worry. As an aside, there's a lot of overlap with these. So sometimes we'll see somebody with panic disorder that also has some OCD, or somebody with OCD that gets panic attacks, or an OCD person that also gets a lot of worries about health and stuff. So there is overlap in these. So I don't want you to self-diagnose. I want you to get to a good anxiety specialist. And I'll give you the questions you need to ask them at the end of this video so you can vet them. We did obsessive compulsive disorder. That would be exposure and response prevention. Now for GAD, so generalized anxiety disorder, you want to see somebody who can do a combination of CBT, cognitive behavioral therapy, but not just raw CBT, because it turns out what a big component of CBT is kind of changing your thinking. And what we've found through a lot of research is if you just change your worries, the worries always come back. So you're going to need some very specialized techniques about worry to really work with worry. And there needs to be an exposure component to it. There needs to be an exposure component. What would that exposure component look like? Well, it's actually helping the person, exposing them to gradually, again, very gradually in a way that they're so when you look at exposure, here's what I want you to think of exposure as. Exposure is kind of like getting used to a scary movie, right? So the first time we see a scary movie it can be distressing. It can be, wow, I don't want to look. This is like, wow, this is really hard to look at. But if we watch it a second time, it's not as scary. If we watch it 5 times, it's scary, even less scary. And then if we watch it 20 or 30 or 50 times, it's like, oh gosh, this is boring. This is not a big deal. So this is a great example of how the amygdala and the associated structures in the brain actually change. So that's kind of how to think about exposure therapy. So then there needs to be with GAD, if you've been diagnosed with GAD or you have a lot of chronic worries about your loved ones getting hurt and or getting sicknesses and illnesses and people dying, and you worry a lot about finances, there's some general areas that people with generalized anxiety will worry about. They'll worry about finances, relationships, work, family members, and so forth, and then health. Those are the big areas that they really kind of perseverate on and kind of get stuck in their worries about. And then maybe another one would be they start worrying about the worry, that they're worrying too much. So then there needs to be two components with that treatment. That's real good solid treatment for GAD. It would have a CBT component, but that's not enough. There are certain very specific key skills that you got to learn in CBT. One of which is to stop the obsessive thinking. Right. So one of the mistakes that kind of novice therapists will make is they'll try to address the worry that's in GAD and generalized anxiety disorder. They'll try to address that worry with things like changing thoughts and identifying cognitive distortions within them. And that can work to a degree, but in a real solid case of high level worry, those techniques go right out the window and they don't work. In fact, what they really do is there is some research that says that it builds up, and that kind of intervention will actually make the GAD worse. So you need some very specific techniques to cut out kind of obsessive thinking in a way, and perseverating on certain worry themes. You need techniques to cut that. And then you also need an exposure part that exposes the person to the worst case scenarios that they're always thinking of. So they may use their imagination. That's one form of exposure, would be imaginal exposure. Another form would be, there's two basic forms of exposure, so one would be imaginal exposure. So we kind of use imaginary scenarios, and those can be evocative. Those can bring up emotions for us. But the more times, just like the scary movie, the more times we watch a scary movie, then anxiety starts to go away, and we start to get some relief from it. So you have imaginal exposure, and then you also have in vivo exposure, actually exposing the person to different scary situations progressively in a progressive way, and then arming them with different coping skills along the way, to help them to cope with their anxiety as their brain kind of gets rewired. So exposure therapy in general is going to rewire the brain. It's going to rewire those lower limbic structures that are responsible for all of this kind of worry. So then we covered, what about PTSD? We might as well just cover that too, as long as we're in here. Post-traumatic stress disorder. These are folks that are experiencing a lot of intrusive thoughts, a lot of nightmares, maybe exaggerated startle response, really get angry, really get kind of irritated, on edge all the time. And these are folks that have usually tragically been exposed to some type of trauma. It could be a violent crime. It could be a series of smaller traumas. It could be a death of somebody. It could be any number of different things can do this and kind of get this. First responders, law enforcement, victims of crimes are all very common with this. We also see like train engineers and so forth that are kind of have to wrestle with this and are affected by this condition. So what are the effective therapies there? Okay, so the most effective therapies are going to be cognitive behavioral therapy to a degree, but there's also some very specific ones. There needs to be an exposure component to it, period. So the only way you get free of that trauma is to the only way you really heal it is by gradually looking at it and getting having a good therapist or a good clinician helping you to get brave enough to gradually look at it little by little. I know that's kind of like totally off the table now. It's like, oh my God, I can't even think of doing that. I can't even sleep, or I can't even get through the day. But that is what a good therapist is going to help you to do, or a good psychologist is going to help you to do this. So you need an exposure component. That will have the names of, here will be the names. Prolonged exposure will be a big one. Cognitive processing therapy, that will be another one that you will hear. CPT. You'll also hear trauma-focused CBT, TF-CBT. You'll hear that. Another one will be EMDR. EMDR can be helpful in a lot of situations. As can, there is a thought field. There's one, Roger Callahan years ago came out with thought field therapy, and that kind of evolved into emotional freedom technique and tapping and so forth. That can have a component in it, but we believe there's also an exposure component in there anyway. Accelerated resolution therapy, ART, and then brain spotting, that is almost like a form of EMDR. Eye movement desensitization reprocessing is EMDR. All of those therapies can be really, really helpful with trauma, with PTSD. Okay, next one. What about panic disorder? Panic disorder. Okay, with panic disorder, there's a certain kind of panic disorder. Basically, is just folks that get really, really scared of having a panic attack, and they freak out, and they start to freak out about their body sensations, and they will go to great lengths to avoid feeling their body sensations because those body sensations hold so much fear for them, either to create a panic attack, or maybe that they're going to get it in a public place and embarrass themselves, or they're going to be driving a car and maybe wreck it or something because of these symptoms. And the symptoms can vary. I could list, no joke, hundreds of these symptoms. Everything from derealization, where we feel like things aren't real, to depersonalization, where we feel we're not in our own body, all the way to numbness and tingling and paresthesia and pains and aches in the brain or in the body. And some people will say in the brain, they'll feel pressure and so forth in their head. They'll feel off balance. They'll feel like their heart is beating really fast, or like they can't get full air, feel really weak in the legs, and the list goes on and on. It could go on. Now, the best treatments for those, again, it's going to be a form of CBT. You want cognitive behavioral therapy in there, but raw cognitive behavioral therapy will not do it. Your clinician needs to have, all of y'all's clinicians and people that you hire to help you to do this need to have training in some type of exposure training, some type of exposure therapy. They need that, and you are going to need that to get fully better. Period. End of story. There's no way you can outthink an anxiety disorder with CBT. By the way, there's another therapy out there that it can help, but it's still it needs to have an exposure component to it, and that would be ACT. It would be ACT, acceptance and commitment therapy. And when acceptance and commitment therapy is done well, when ACT is done well, then it will have for an anxiety disorder, will have exposure parts in it that really help with that. So the types of exposure that work with panic disorder are going to be interoceptive exposure, progressive exposure, both of those. Interoceptive exposure is just kind of learning how to be okay with the different body sensations that are in our body, and to recognize that they're not dangerous, and to kind of retrain the brain that they're not dangerous. So that would be that. The other type of therapy that you would want would be progressive exposure. So kind of progressively exposing, and they may use both this imaginal exposure, imaginary situations, and they may use in vivo or live situations, and even combine the two and put them together. So those would be the exposure therapies of that. What about illness anxiety? Illness anxiety is definitely going to have an exposure component to it. It needs it. You cannot rewire the brain unless you have an exposure component. You can't, all of the anxiety disorders, you cannot outthink them, period. End of story. There's no way you're going to analyze your way out. There's no way. The reason why is because these disorders are coming from a very deep part of the brain. We could call it the subconscious, or the level below outer cortical awareness. This would be like the outer cortex of the brain. So all of these conditions are rooted in this part here, this subconscious part, the amygdala, the hippocampus, the brainstem, the striatum, and so forth, that kind of hang over the top of those, act as the gear shifters, the caudate nuclei, and so forth. Those are all deep structures in the brain. You're not going to get to those structures with thinking, with trying to think your way out of it. Maybe you've noticed that. If I try to calm myself down, it doesn't work so well when I'm at a 40 or 50 or above. It works marginally, if at all, and if you're really anxious, it doesn't work at all. And that is because when these structures in the brain, these deep brain structures, when they get turned on, it literally it's almost like you blow your lid. This outer cortex that can think well, that can analyze, that that can articulate and verbalize what's going on, that all goes offline. And that is no longer present anymore. It's still present physically, but it's literally hijacked by the amygdala. And this was supposed to evolve this way. Allows us to survive. If Oog and Og were on a path, the cave people, there they are, and they're Oog and Og is going along, and Oog says, "What's that?" and turns around and hears a branch snap. And Og didn't even really think about it. As soon as he even caught a hint of it cracking, he was already 30 yards up the path. Well, kind of guess who survives? Poor Oog. Oog gets eaten. The one that didn't hear it and is asking verbally, "What's that?" They're already getting eaten. So that is why the brain just got really, really good at not using verbal processing at all. And that's why it's unaffected by verbal processing. That's why with like GAD, with generalized anxiety disorder, if you just use CBT, like cognitive behavioral methods, where you're just trying to cancel out thoughts and you're looking at how distorted they are and you're kind of replacing them with new thoughts, it doesn't work. It doesn't work. It's marginally effective. You need an exposure component to it that actually gets this lower part of the brain engaged and gets it to learn and rewire itself. So there you go. So there's panic disorder, illness, anxiety. We talked about OCD with exposure and response prevention. What about simple phobias? Phobias, absolutely, you're going to need an exposure component. If I'm afraid of spiders, I'm going to gradually, with a good therapist, I'm going to maybe talk about spiders first a little bit, and then we'll look at pictures of some small spiders, and we'll gradually kind of build our resistance is one way to frame it. That's technically not what's going on, but we're building our resistance. There are two things that are happening with exposure therapy and why they work, and we can get into those in another video, why this works and why it's the gold standard. But that is what you're looking for from a good therapist. If your therapist is not certified in these things, if they have not taken actual training, and you need to be bold and ask them, what training have you taken in exposure therapy? And they better not say, "Oh, I took it, I took a little seminar, I took a training last year on it." No, they better be up to date and fully certified and trained in this and how to do this. This is what's going to get you the biggest bang for your buck and get you further along quicker to get you to feel better. And I think a lot of lip service is paid to CBT now. It's the flavor of the month where people say, "Oh yeah, I do CBT. I do CBT. I do CBT." No, you don't. Those people were not trained in it. They did not go to get the certifications in it. They did not, it's an enormous amount of training to do good exposure therapy correctly, and to do good CBT for anxiety disorders correctly takes a lot of training. They're not like classical depression kinds of illnesses, or maybe other types of conditions that respond very well to CBT, maybe insomnia, or maybe body type distortion stuff. There are certain forms of depression that respond very well to CBT, into kind of restructuring your thoughts and kind of looking at your beliefs and seeing if they're rational or not. But anxiety disorders are minimally touchable by CBT. You need a very specific form of cognitive behavioral therapy, namely exposure therapy, combined with some really, really good methods of dealing with the thinking that comes up with all of those. Now, if you engage in those things, and so you want to find a therapist that's certified, you want to find a therapist that is licensed, you want to find a therapist that can really declare what their training is and really tell you, "Here, this is what I've been trained in. This is what I studied this time. This is who I studied with. This is who I was trained by. This is their certification process." So be an informed consumer. Be an informed consumer. And the one that I didn't mention was social anxiety. So what type of therapy is good for social anxiety? That person wants to be really, really good at both in vivo. The therapist that does this and treats this wants to be good at imaginal and in vivo exposure. And there are very specific protocols set up for social anxiety to use exposure as well to help with this. So there you go. So hopefully that gives you some good things. Obviously, you want a personal connection. Any good therapist worth their salt is going to talk with you, even for free, for 20 minutes over the phone, just to kind of ask them some of these questions to vet them. You want to go to the place that you would go to look for a therapist would be on Psychology Today. You'll go on psychologytoday.com and you'll put in where your area is. And now, the whole area is kind of open in your state. Most states are very much open to therapy being done through telehealth and so forth. So you have that. You can kind of blanket your entire state, looking for the best exposure therapists, looking for the best people who are really good at treating anxiety to get you started, to get you feeling better. And that would be the goal. So hopefully that helps. Hopefully that was helpful for you. So we want a therapist that's absolutely state licensed. We want a therapist who is excellent at exposure therapy, and we want to be able to vet where their training was. Here's what you don't want. You don't want somebody learning. You don't want somebody who is an intern. You don't want somebody who's working on their licensure. You don't want any of those. And people are going to get mad at me for saying this. Why would you say that? There's good therapists that are trying to be, good people learning, and they're, they got skill. I want you to get the best, fastest recovery that you can, to get better faster, to feel better the fastest you can. It's great that those people are learning. It's great that I had to learn too. But I was not ready to handle a full-on anxiety disorder and all the complexities of it when I was an intern or when I was studying in my supervision 20 years ago to try and figure this out. So you want somebody that's experienced, that knows what they're doing. Very good. So catch you on the next video. Oh, and the other thing I would say is do something scary. That's going to help you.